Thanks for joining today's webinar. My name is Isha Weerasinghe, and I am the Director of Policy and Advocacy at APCHO, the Association of Asian Pacific Community Health Organizations. Today, we're really excited to present the session on understanding and combating hepatitis B-related stigma and discrimination, which we know a lot of you work on today. But before we get started, I'd like to review a few housekeeping items and let you know how you can participate in today's Hangout. Please note that all attendees are in listen-only mode and will be muted during the presentations. There's also a phone-in option, and the call-in numbers are below in case you're having issues with your computer. You can submit questions in writing during the presentation by typing them in the question box on your GoToWebinar control panel. We're going to be reviewing them as they come in, and we're going to hold a question and answer period after the presentation. Finally, today's webinar is being recorded. You're going to receive an email with the link to view the recording and share today's presentation with your partners as well. At the end of this webinar, there will be a link that pops up, or a window that pops up with a survey. Please try to answer those questions if you're able to. The more responses that we receive, the better we'll be able to tailor Hep B United materials and webinars in the future. So next slide, please. So today's webinar is being presented by Hep B United. Hep B United was founded about 5 years ago by the Hepatitis B Foundation and by my organization, APCHO. It is a national coalition of over 30 organizations across the country, and our mission is dedicated to reducing the health disparities associated with hepatitis B by increasing awareness, screening, vaccination, and linkage to care for high-risk communities. Our coalition serves as a voice for hepatitis B advocacy locally and nationally, and we do that by advocating for increased resources for Hep B prevention and treatment. Members of Hep B United are community-based hepatitis B coalitions, which are comprised of stakeholders from a variety of sectors. Many include coalitions made of health clinics, local or state health departments, social service organizations, and academic research institutes. Today, we're talking about addressing the stigma that many who are affected by hepatitis B face in their daily lives. But before we move to our speakers today, I wanted to go over what stigma is. Next slide, please. So we all know, as you are all on the call, that many populations impacted by Hep B face stigma. But stigma is defined as a mark of disgrace, either whether real or perceived, that sets someone apart or from others. Those that feel stigma can feel shame, hopelessness, loneliness, social isolation, and much more. And stigma can lead to being treated differently from others in one's family and community, a lack of access, more discrimination, and discrimination in the healthcare space, but also in housing, employment, and many other sectors. So we're really glad that we have two great speakers for you today who are working to address stigma in their own ways, and look forward to discussing ways that you address stigma in the Q&A section as well. Next slide, please. So today, Janice Liu from Charles B. Wang Community Health Center, who's the Senior Hepatitis B Program Associate, is going to start by talking about Charles B. Wang Community Health Center's programs to address hepatitis B and how they address stigma. And then Beverly Quintana from APCHO, who is our communications manager, is going to talk to you about APCHO's stigma toolkit, hepatitis B stigma toolkit, and how we developed it and how it was created to address stigma as well. So with that, I'll pass it over to Janice.
Great, thank you so much, Isha. Hello, everyone. Thank you for having me on today's webinar. Once again, my name is Janice Liu. I'm the Senior Hepatitis B Program Associate at the Charles C. Wang Community Health Center located in New York. Today, I'll briefly talk about the ways in which we at the Charles C. Wang Community Health Center address Hep B stigma in the community. But before, I would like to provide a background on CBW. Next slide. The Charles C. Wang Community Health Center is a federally qualified health center with multidisciplinary care providing mainly adult, pediatric, OBGYN services in Chinatown, Lower Manhattan, and Flushing, Queens. We've historically focused on the medically underserved and Asian Americans, having bilingual staff fluent in English and one other language such as Mandarin, Cantonese, or Vietnamese. And we are unique in that Hep B is being managed in the primary care setting. We also have a research and evaluation, health education, marketing and communications department on site to support other initiatives such as research or Hep B outreach. So next slide, please. So how many chronic Hep B patients do we see? We actually have a report called the Hep B Registry that is used to capture and track all patients diagnosed with chronic Hep B at our clinic. And there are about 8,500 patients with chronic hepatitis B in that registry. And of those, about half of them are active patients, meaning they were seen at least once in the health center in the past 2 years. And about 27% of those are uninsured patients. Next slide. Since about 1 in 8 of our patients have chronic hepatitis B, we developed 2 unique hepatitis B programs that identifies high-risk individuals and provide close case management. Notably, the hepatitis B program, where we provide services for the uninsured Hep B patients with high risk for HCC. And the next slide. Next slide, please. And the Hep B Moms program that identifies pregnant mothers with HBV and manages the Hep B care, as well as educates the mothers on ways to prevent perinatal transmission of Hep B to their infants. Next slide. I also wanted to provide a quick overview of our primary care model for hepatitis B care at CBW. Some things to highlight are that we have unique hepatitis B personnel, such as myself, the Hep B program manager, and a care manager that provides direct Hep B counseling and care coordination to patients, which I'll get into more later on in the presentation and point out their roles in addressing stigma. These programs and models have been developed over 10 years, and for those that are interested in learning more, please feel free to contact me after the webinar. I'll be more than glad to share about our model. Next slide. So when Isha and Kate asked me about what types of Hep B stigma CBW face in our day-to-day work, I thought about it, and as a clinical site, we don't get to hear patient stories about how they face discrimination at work or home very often, given the short visit times. But Hep B-related stigma will exist, and we are reminded when new patients visit our facility. After patients get diagnosed with chronic hepatitis B, providers and care managers ask patients about their knowledge of Hep B, and we see that patients lack understanding or have been misinformed about their condition previously. Despite being a disease that is prevalent in Africa and Asia, which makes up most of our patient population, many patients tell us or say like, oh yes, I've heard of Hep B, but I don't know too much about it. Or we often hear, I think my mom has it, but I'm not too sure. This in itself is actually an indication of Hep B-related stigma that still exists, as patients do not openly talk about it with their family or in their community. We also hear similar situations when spouses of women with Hep B visit our clinic asking for hepatitis B screening, explaining that they have just heard about their wife having Hep B and wants to get checked as well, since they know that it can be spread by sexual contact. At times, sometimes these spouses actually display anger and frustration at the situation. This actually is another effect of Hep B stigma in our patient population, and indicates that there is limited discussion around Hep B in the community and the families for them to openly talk about it and ultimately get themselves preventative measures such as vaccines. In addition, we've also seen a good number of cases where myths about Hep B mislead patients and prevent them from accessing appropriate care. It does not help that Hep B is a condition with no visible symptoms, which I think plays a huge role in stigmatizing Hep B. It provides a false notion that patients are fine and shouldn't be worried. Of course, we know that Hep B is a chronic condition and patients should be monitored at least every 6 to 12 months despite feeling okay. Also, through our Hep B Moms program, we encounter women of childbearing age that worry about getting pregnant since they misunderstand that Hep B can be passed on genetically. And we also hear mothers who just delivered saying that they worry about breastfeeding their infant because of their Hep B. I actually think these are all effects of how Hep B stigma affect our patient population. Next slide, please. Next slide. With these stigmas in mind, CBW felt that providing appropriate education to the patients, but also to the providers that serve the community is key in addressing Hep B stigma. On site, we have Hep B specific internal protocols in place that can be accessed to all staff to learn more about Hep B in reference to, along with monthly meetings to provide updated clinical Hep B guidelines and an opportunity to discuss specific Hep B cases among the providers and clinical staff. We also partner with outside organizations to host CME trainings or seminars on Hep B to educate other community providers as well. We want to ensure that the right, accurate information is being communicated in an effective, appropriate manner by the providers and clinical staff to the patients, so since we see the providers as the frontline resources for patients. Next slide, please. We encourage all level of clinical staff to educate the patients about their Hep B, and we do believe that with repetition that patients remember this information better and understand the seriousness of the condition. So we've actually adopted the EMR to remind and support clinical staff to provide Hep B education when they can. Next slide. We also, unfortunately, sometimes because we are a clinical site, nurses and providers don't get too much time with the patients and can only provide a general Hep B education. And everyone's concern and questions about Hep B can be different. To address this, we've also identified key personnel, which is in our case, a hepatitis C care manager that can provide more comprehensive and individualized education to the patient after assessing their knowledge. Care managers have many other responsibilities, which I've listed in the slides, but providing Hep B education to the patient is one of their main responsibilities. They're also the person that patients can comfortably open up to and talk to about their fears and concerns about Hep B, which we believe is a key step in addressing Hep B stigma. Next slide, please. And one of the key components of the care manager's education is to talk to the patients about their household contacts. The care managers encourage the patients to talk to their spouse, family, or friends about Hep B, ultimately hoping to break the silo and to encourage them to get screened for hepatitis as well. And to support that cause, we at the Charles E. Wang Community Health Center offer free first-time Hep B screening for anyone who walks into our clinic. Next slide, please. In addition, we want patients to be more proactive about their health and to retain and share their Hep B knowledge with others. So we actually developed unique Hep B education tools and resources. Here we have a hepatitis B screening and treatment tracker that reminds patients about the types of HBV blood tests and imaging tests that they need to know and get regularly. The tracker also allows patients to record the results, and it's actually really helpful when patients transition to another PCP and need to carry over the information. This year, actually, we've also developed a visual education material, the hepatitis B comic book called The Test, and for our patients with low health literacy. With the goal to raise awareness about getting tested for Hep B, we made a comic book about a nurse practitioner who encourages members of her community to get tested for Hep B. The story follows each character as they receive and interpret the test results. Next slide. We also have very specific education materials for mothers and women of childbearing age with hepatitis B in hopes of addressing the myths and educating them about the appropriate steps to protect their infants, such as taking a medication at the third trimester if needed, or providing time-appropriate prophylaxis for the infants. Next slide. Actually, all these materials are available on our Hepatitis B website, which is shown in the link above, and it is open to the public for use. Next slide, please. Yeah. In summary, I just wanted to, the takeaway point would be that Hep B stigma actually still exists in the community in many different forms. And while there are many routes to address the stigma, at our health center, we thought that a good place to start would be to educate the patient, but as well as the provider. Thank you, and that's my contact information. Anyone wants to talk more about CBW or HEP and how we address Hep B.
Thanks so much, Janice. Thanks for sharing the amazing work that CBW does. And for all of you listening in, I just encourage you, if you have any questions or comments about how CBW does the work that they do and works to address stigma, please put that in the chat box so we can go over that at the end of this webinar. And with that, I'll pass it over to Beverly to talk about APJA's Hep B Stigma Toolkit.
Great, thanks, Isha, and hello everyone. It's great to connect with you all today. We're pretty excited to share our latest resource with you entitled Understanding and Combating Stigma, a toolkit for improving care and support for people affected by HBV, which I'll be talking more about in the following slide. Next slide. But before we jump into the toolkit, I wanted to quickly tell you a little bit about APJA and their work around hepatitis B. So the Association of Asian Pacific Community Health Organizations, or APJA for short, is the National Association of Community Health Organizations. And right now we have currently 33 members, 28 of which are federally qualified health centers, and primarily serving Asian Americans, Native Hawaiians, and Pacific Islanders, but other underserved communities as well. APJA and their members are dedicated to improving the health status and access of these medically underserved communities. And in 2015, APJA members served nearly 500,000 patients and providing services in over 15 languages. 68 of those patients that were served were Asian Americans, Native Hawaiians, and Pacific Islanders. Next slide, please. This slide goes over some of APJA's hepatitis B activities. So APJA works primarily in two areas around hepatitis B. One is to increase awareness about the impact of hepatitis B on A and NHPIs and other at-risk populations, and that's through our work with Hep B United and also through our APJA member health centers and broader network of community-based organizations. Secondly, we develop and disseminate resources and tools to improve hepatitis B prevention, care, and treatment, including the toolkit that we're talking about today, but also other resources that you can find on our website. Next slide. So Isha already described Hep B United, but to talk a little bit about APJA's work with it is we work with Hep B United, again, on a national level, but also with a local coalition to raise the profile of hepatitis B and liver cancer, especially on the populations that I mentioned before. This year, there was a national summit, and we're working with Hep B United around mini grants, which Kate later on can provide more information about also. Isha, who's based in DC, meets a lot with policymakers to advance the Hep B agenda, and we also work around stopping stigma, which is why we developed this toolkit and work with Hep B United for their Just Be Story campaign. And again, they note here that we work with our community health centers and national and local CBO partners. Next slide, please. And so around developing resources, for our latest toolkit, Understanding and Combating Stigma, a toolkit for improving care and support for people affected by HBV. Our aim is to really provide a curriculum for community-based organizations, specifically health centers, but also others who work with people affected by the hepatitis C virus and experience stigma and discrimination because of it. I wanted to first acknowledge our contributing reviewers who helped us develop this really important and helpful resource. And the reviewers range from Action Member Health Center staff, including Janice, who just presented. Thanks again, Janice. And to our Hep B United national and local coalition partners who are on the ground providing care to the affected and at-risk populations. Next slide, please. So what's in this toolkit and why was it developed? Again, this toolkit is a collection of participatory educational exercises which are learner-centered and built around small discussions and group activities. The exercises are designed to get participants learning through doing, including through sharing feelings, concerns, and experiences, discussing and analyzing issues, solving problems, planning, and taking action. The toolkit includes modules with, again, participatory learning exercises that you can choose and adapt for your target groups. Pick and choose and to suit the individuals and organizations you're working with at that time. The intent is to open dialogue and not make Hep B taboo, especially for the at-risk populations. And that may have a lot of hesitancy to talk about this, like John mentioned in her presentation. Next slide, please. Who can use this toolkit? We designed this toolkit for anyone really who are working with the affected populations. So some examples are HBV healthcare providers or educators who provide direct services or conduct health education sessions for community groups, and other practitioners or provide individual or group counseling on HBV issues. You could be a community member or part of a community-based group, and such as youth groups, churches, family support groups, etc. You could be someone who is living with HBV or know someone or have a loved one who is affected by HBV. And another example is someone who can use this materials is for communicators or advocates working on Hep B issues, and you can adapt the modules to speak with the media, policymakers, other community-based organizations and partners. Next slide, please. Okay, so jumping into the toolkit. So our intent really was to get into the exercises and provide just a really short intro about the global impact of hepatitis B. We saved more of the stats for later down the road because we wanted to hone in on addressing and understanding stigma. And so you can look at the different modules we go into here. A lot of them, including module A through E, really talk about the different at-risk groups and how you can address stigma within them. And then the last module, and including at the healthcare setting, especially for health centers and other providers. And lastly, the last module, module E, we provide you with some next steps and tools to actually move into action. Next slide, please. And again, we do include the appendix where there is more factual-based information, including stats about hepatitis B for participants or organizers who may not be as informed about the numbers. But we really wanted to emphasize the people behind the numbers, since it is, in fact, a stigma toolkit. Next slide. Okay, so these two or three following slides just gives you a little peek into that toolkit and how we structure the individual modules. This is an excerpt from the Combating Stigma in the Healthcare Setting module. And as you can see here, for each module, we wanted to provide you with a consistent format. So we include objectives, a suggested time to allot for these exercises. So it could be role-playing, small group discussions, drawing, and so forth. and we do provide a recommended list of materials, which some are included in the appendix. And then on the right, we go into the activities and give you some instructions. And actually, as Janice was presenting during her slides, her examples of the different instances of stigma that she's heard about have been is noted, or is really similar to the example we provide on this page about a woman coming into a clinic and family members not being as aware about the status of their loved ones. So that was really great to hear that this toolkit is addressing real issues happening on the ground. Next slide, please. This is another excerpt from another module called Understanding Stigma in Your Family and Community. Again, it has the 4 sections, so that's objectives, time, materials, and activities. So this particular exercise has participants going into breakout groups and then has suggested summary or kind of regroup discussions after the breakup groups. And then that box there, and I'm not sure if you can see it on your screen or if it's too small, provides you with some examples of stigma and how to address them within the family setting. And I meant to mention earlier, a lot of the modules give you some guidance depending on the group that you're talking about and what setting they're in. So here you're talking about within the household. Isha, or Janice as well, talked about, household contacts, which is the huge concerns for people affected by hepatitis B. And we go into a lot of the common concerns for folks in the toolkit. Next slide. Oh, I guess. All right. So hopefully I didn't go too fast on the module, but I think that you can access a link to the toolkit itself on your controller panel, but it's also available on their website as noted here. We have a dedicated email in case you have any questions or have feedback for improving the toolkit there, and my contact, and as well as Isha's, is listed on this side in case you have any questions. Isha, I think that is my last slide.
Great, Beverly, thank you. So just like Bev said, the stigma toolkit is included in the handouts section of your control panel if you'd like to take a look at it and have a copy of it. So we're going to move into the Q&A portion of our webinar. As mentioned in the beginning of the call, we're going to start by answering questions that were submitted to us via the chat box. If you'd like to submit a question now, please do so by using the questions field on your screen. So our first question comes from Randall Reeves, and it's for Janice. So Janice, the question is about CBW's structure. Is your position as coordinator a full-time one? Yes. And how is...
Sorry, go on. I didn't...
So, no, that's okay. No problem. And then if so, how does CBW fund these important activities?
Yeah, well, yes, my position itself is a full-time, and so are our care managers and a program director. So everyone is full-time. Actually, the program director, it's half clinic and half admin time, but everyone here is full-time. Our positions are actually, fortunately, CBW, it's funded, fortunately, through CBW's internal money, and while we do have some grants that, part of my income is paid with through the grants, but I think because the program's been around for like 10 plus years, and really CBW identified Hep B as something that needs to be addressed in the community, they actually invested in internally to have a Hep B personnel. But I know that sometimes some centers might not have that resources. So I do recommend maybe seeking out grants or other like government funding opportunities, because I do know that in New York City, we have a program called the Check Hep B program that is funded by our city council members of New York that provides the income for the patient navigators / care managers for hepatitis B.
And thanks, Janice. And this is Isha. I'd second that recommendation by Janice. If you build relationships with your, if you're in a city, your city council members or your local legislators, that can also help you to generate resources to fund these really important positions, along with private and public funds. So Janice, the next question is for you too.
Yes.
So does CBW have more clients complete chronic Hep B labs and exams by providing chronic Hep B management in-house, or do you refer out?
So was the question whether we manage the Hep B at our own site?
Yes.
Yeah. So CBW is very unique in the sense that like all of the chronic Hep B patients are being managed by our primary care providers, and we do have, again, a very special position, the Hepatitis B program director, who is more knowledgeable about Hep B, who actually educates new providers that work at our health center, and also kind of serves as a reference for a lot of these providers in treating Hep B. We do work closely with specialists such as hepatologists or infectious disease doctors in the community in the case that the Hep B cases get really complicated or there are signs of hepatocellular carcinoma. In that case, we definitely refer out and work with the local specialists as well as the health and hospitals in our community.
Thanks, Janice. The next question asks whether we have a similar toolkit for people affected by HCV. Beth, do you want to take that, or do you want me to?
We can both take it, I guess. Right. So as far as APSHA goes, I don't think that we have one that's for HCV affected communities, but I know that the exercises, that the way we develop them can deal or help you deal with stigma and discrimination associated with other diseases. I'm sure. Isha, do you agree?
Yes. The reason why we had created this toolkit was because nothing existed thus far for hepatitis B, but for Hep C, our partners at NASPAD have created a Hep C and HIV stigma toolkit. Mm-hmm. So that one is a great resource. The one that we developed is more catered towards at-risk populations for Hep B, but I think that NASPAD toolkit could be adapted for those at-risk populations as well. Thanks, Bev. Next question is, do you know of a resource that includes health messages that help to overcome common myths that cause stigma? The question was raised because these myths vary between cultures. It would be helpful to have such a resource that addresses a variety of different cultural myths. So one answer to that question is the No Hep B campaign, the CDC No Hep B campaign. They have materials that have those messages that address common myths about hepatitis B. So I encourage you to look at the No Hep B webpage, which if you look at CDC's hepatitis B page, there will be links to the No Hep B campaign. Janice or Bev, do you have any other responses to that?
Just a short one. I think that some of the resources that Isha mentioned and others also are included in the this toolkit's appendix. So I really would recommend, even if you look at that, I think you'll find more resources that would be helpful.
Yeah, I mean, one thing I would like to comment is that Hepatitis B comic books that I've introduced in my slides, that's actually tailored towards the Asian population more. If you can also just look through the way the characters were drawn. So that could be a resource for those that are interested in addressing Hep B stigma in the Asian community. But for the other populations, I like Isha mentioned, I think the CDC No Hepatitis B campaign materials are really good too.
Thank you both. Are there any other questions? And while you're thinking about them, I also encourage you to provide any input that you have about how your organization works to address stigma, or to share with other people who have joined the webinar. Do we have any other questions?
Hey, Isha, this is Kate. I have a question for Janice. Janice, how do you see using the toolkit in your work currently?
Yeah, definitely. Well, I actually see the toolkit being a good resource for patients helping their clinic, of those who do have Hep B, who want to actually open up about their condition, or like talk to their family members or households about their Hep B but don't know how to, and is worried about the stigma that can follow. So I do really think that the toolkit will be great resources and to provide for the patients at our clinics that come and want to talk about Hep B. Also, I think it's great for the providers too, to definitely at least know of ways and methods to talk to the patients, and activities to do with the patients in the case that they feel that the patient is have certain stigma, or want to try to open the patient up more about their hepatitis B.
Thank you. And Isha, this is Beverly. I should have asked or included information about this, but I was wondering if Janice, Kate, or Isha, either three of you could provide any information if someone does experience some sort of stigma or actual discrimination, whether it be in a healthcare setting or not, around hepatitis B. Do you have any recommendations as far as like what actions to take?
Would you like me to take that one?
Sure, go ahead, Kate.
So there are a couple of things that if you have a patient in your health center or one of your community members who are experiencing hepatitis B-related stigma or discrimination, here at the Hepatitis B Foundation where I work, we have a helpline. So if they email info@hepb.org with their incident, we have resources that we can work with directly with that person to address that discrimination issue in particular. A few years ago, we were working on a case where a student was applying to medical school, got accepted, and then once the board found out that he had hepatitis B, was diagnosed with hepatitis B, they revoked his acceptance into that school. So our organization, along with other advocates, brought this to the attention of the U.S. Department of Education, Department of Justice, as well as the Department of Health and Human Services. And the Department of Justice took this case against that medical school, and we settled with the school, and the outcome of that finding is that hepatitis B is protected under the Americans with Disabilities Act. This is something that we really want everyone that's experiencing discrimination, whether it's in the workplace or other settings, to know about. You know, if you do know someone that's experiencing that, we can help them file a complaint or connect them with our contacts at the Department of Justice or other sources that can help walk them through that, you know, what they're experiencing.
Thanks so much, Kate.
That's really helpful, Kate. Thank you. So we will also include some brief overview of those key resources that we mentioned and what Kate mentioned in the follow-up. But just to repeat again where you can find a similar toolkit for HCV, because that question was asked again. That's through NASTAD, NASTAD. They have an HIV and Hep C stigma toolkit as well. It's not created in the same curriculum format, but it is working to address stigma. And then we received a comment from ICHS, International Community Health Services in Seattle, saying that the Hep B Coalition of Washington produced a 13-page photo novel, which is like a storybook, and it's written in Amharic for the Ethiopian population. And that addresses Hep B issues in communities that face stigma as well. So whoever is on from ICHS, if you could send that photo novel to us too, we can help to distribute that as well after the webinar. And they're working to produce similar photo novels in Somali and Swahili in the coming years. Okay, perfect. And I see that it's Mohammed. So Mohammed, if you could send that photo novel to us, that would be really helpful. So I don't see any other questions unless someone has a pressing question that they want to include in the question box. But I want to encourage you all, if you think of questions or comments or want to talk about the toolkit or other work that CBW does, to contact either Janice, Beverly, or myself, and want to thank you for your questions and for the rich discussion. If we were unable to answer any of your questions today, please don't hesitate to contact us. You can get updates on Hep B programs and policy activities at www.hepbunited.org. And you can access the Hep B Stigma Toolkit at the APCHA website, but probably more easily through the link that Beverly provided in her slide. And also, I also want to orient you to the Just Be Storytelling campaign, which works to raise awareness of hepatitis B and those affected by hepatitis B, and also address the stigma caused by hepatitis B. Lastly, and most importantly, I want to thank both Janice and Beverly for taking their time to share their experiences and their amazing work with us. Please look out for a message from the Hepatitis B Foundation within the next coming days, which are going to include materials from today's webinar and hopefully those resources that came up in the Q&A as well. As I mentioned earlier, we would greatly appreciate your feedback on a short survey as you exit the session. So thank you all for participating and have a great rest of your day.